honest with you. We're not being recorded, so I can say that. After an exam, let's see, that exam started at 9, I'd have been done by like 9:18 and been across the street. Not because I was smart, I just bubbled in any answer. Okay, so situation, background, assessment, and recommendation. Okay? Actually, I'm just flattered that you're all here, that's it. You must have a class at noon or what?
No.
I love you all. Until next year when I don't get to teach you or anything anymore, then you'll all forget about me and I'll forget about you. But then I won't forget about you. Okay, so everybody got this in their head? Now this should look familiar to you. Jason Jones is a 7-month-old Caucasian. He's a 7-month-old boy who presents with symptoms of an ear infection. Patient's mother, Stacy's been tugging on his ears over the last day or so. He also has a fever, which started around the same time, went up to 104, which is taken rectally. Mother denies any altered mental status associated with the fever. He's fussy, crying, which is inconsolable. He's also not sleeping well, denies increased sedation of lethargy. Patient attends daycare, blah, 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 blah. So everybody kind of read over that, and then we're going to go ahead and come up with an Sbar for this patient, right? You're all familiar with this patient? If you're not, you better not have gotten any points in lab. Okay, so Palm Beach, I would like you to, after reading this, I'll give you another minute, one of you brave souls to push your microphone button and give me the SB part of this, right? The situation and background. Remember, quick, succinct, okay? Just what you need to know. So basically the situation here is, you guys all talk to this mother. We're going to assume the objectives data came back saying it's okay, it's an ear infection, okay, since we didn't get objective data. I want you now, you're going to now communicate to the doctor. You're looking to go ahead and make a recommendation, okay? So situation, background, then we'll have somebody else do the assessment and somebody else do the recommendation, okay? So Palm Beach, give me the situation and background. Unfortunately not.
7-month-old infant with a
Can you hear us, Professor?
I heard 7-month-old infant with a pos, and then it stopped. Yes, I can hear you.
Possible ear infection.
Okay, but we're assuming now that this is at the end of everything. You've gotten objective data back, you've gotten everything. It's an ear infection. So now tell me about it.
It probably hurts the child.
I'm sorry?
It's causing most of the child's symptoms, such as the fever, the tugging on the ears, the insoluble crying. Do you mean what medication we would recommend?
No, I just want the situation and background portion. So I would say, here, let me help you out. We have a 7-month-old boy with symptoms of an ear infection. He's had a fever, trouble sleeping, diarrhea, and increased urination. There's no other pertinent signs or symptoms. Mother has used ibuprofen with relief for the fever. See how quick, simple that is summing up? I don't need every piece of information that says it's an ear infection. I don't need every little bit of information, right? I'm just trying to orient the physician to who it is I'm talking about, okay? The physician, and you should build this kind of rapport with people, but the physician should assume that you understand what you're talking about. So when I say it's a 7-month-old boy with signs and symptoms of an ear infection, I don't need to say tugging at the ear, inconsolable crying. I'm a healthcare provider. I know what signs and symptoms of an ear infection are. He's a healthcare provider. He understands, or she understands, what signs and symptoms of an ear infection are. So therefore, I don't have to spell out all the different signs and symptoms. I will mention there's a fever because that's pertinent, right? So 7-month-old boy, I'm giving him, it's a boy, he's 7 months old, it's an infant, right? So that's my patient. He's got an ear infection, he's had a fever, he's had a couple other signs and symptoms, trouble sleeping. I'm mentioning the diarrhea and increased urination because then when I make my recommendation for treatment, that's in his head too, in case what I make a recommendation for would not necessarily be good in case the kid's dehydrated or something. It's just giving him a little more information about other possible things that could be going on with him. And he has had some ibuprofen so if he wants to give something for the fever, he now knows that the mom's used ibuprofen, she has ibuprofen at home, and it's worked. Right? Does that make sense? See how I kind of combine situation and background? Because I've never quite understood how to separate them out. To me, it's kind of one thing. Right? Okay. So now we get to our, what? SBA is our assessment. So, that's the background. I'm not saying he necessarily had an ear infection yet, because it's just the background, right? Now my assessment is going to be what I think is going on with the kid, right? So, based on the signs and symptoms, I believe the patient is suffering from otitis media with a lack of external symptoms. We didn't have any objective information for this case, but this is where I might say that, you know, a chest x-ray showed this, or this, you know, if it's relevant to it, right? Okay, so that's where your assessment is going to be, this is what I think is going on and why. But, quick and succinct, not a big long thing. It's a little 5-sentence, this is what I think is going on. This whole presentation to another healthcare provider should be 30 seconds to a minute, at the most. Okay? So now, I think it's otitis media, there's no external component, because we've looked at his ears, whatever else, there's nothing going on there. So I believe it's that, and as such, since I believe that that's what it is, I recommend we give the child amoxicillin 400 milligrams by mouth every 12 hours for 10 days. We'll reassess him in 3 days for symptom relief. If there's no relief, I recommend changing to augmentin 400 by mouth every 12 hours. That's what I want to do. Did everybody follow along there? San Juan, does that make sense to you guys, what we just did? Hello, San Juan.
Yes.
Good. Can anybody tell me what the dose of amoxicillin is for a pediatric patient? 80 to 90 milligrams per kilogram. Does anybody know what the dose of augmentin is for a child? An infant under 2? 80 to 90 milligrams. How did I come up with 400? 80 is like 360 or 380, and the 90 is 525, 425, so 400 sounds good to me. It's in the middle, right? I'm sorry? No, he's 7 months old. We're going to probably give him the suspension, not a tablet. The question was, would we give him a tablet? No. It does come in what? I'm sorry, you don't take a suspension by mouth? Will you take a suspension in your ear? No. Suspensions do have milligrams.
Milligram per milliliter.
Suspensions have concentrations, right? So it's X milligrams per milliliter. That's good. You just came up with a good question for all of us. Thank you. So ready? Get a pen and paper out. So we want to do this for this child. Okay, so 400 milligrams twice a day for 10 days, right? It comes in, wait, hold on. It comes in
There is 200, there is 400.
250 milligram per milliliter, 10 milliliter bottles.
10.
250 per milliliter. I'm sorry, 250 per 10 ml. No. 250 per ml, 10 ml bottles. How many mLs would the patient have to take? And how many bottles would you have to dispense?
250 per ml.
Oh, it's 250 per ml, 10 ml bottles when it's reconstituted. Thanks for creating work for everybody. That was awesome of you. I appreciate it.
You're welcome, everyone. You're welcome.
Doesn't matter what he weighs. You have a dose that you need. But he weighs like 21.3 pounds. So, how are we going to figure this out? Because this is something that comes up all the time in retail. So, 250 per ml, 10 ml bottle. So how much is in a bottle? 2,500 milligrams. How many milligrams does he need a day? 800. So one 2,500 milligram bottle will last him 3 days. Right? So basically he needs how many bottles? 4 bottles. Huh? No, we would give him the whole supply. It's not like we're going to give him a 3-day supply and then if he's doing okay and getting better, we give more. No, when they write the prescription, they write for 10 days. You just want to make sure it's working, because if not, we need to switch to something else. Right? Everybody see how you do that math? Dr. Finkel would be proud. Okay, so let's try again. This should look familiar to you. This is Miss Rita Cross. She should look very familiar to you. You just saw her